Hello everyone, I'm Bala Sankuratri. I am an IDP candidate for class of 2026 at IU School of Dentistry. I'm now in my D3 fall semester. And to talk a little bit of background, I did my BDS from India from Sibar Institute of Dental Sciences and I graduated in 2019. After that, I moved to USA to do my master's in public health. I did it from UTA. I majored in epidemiology and urban health. And as of now, I'm pursuing my DDS at IU. So after my master's and before I got into the school, I worked as a research assistant at MCH Equity Lab. We mostly worked on research pertaining to maternal and child health in Black women and Black community with diabetes and pre-diabetes. We were also associated with the Tarrant County Public Health. And apart from that, I also worked as an epidemiologist and oral health counselor at Pediatric Center of Round Rock. This is situated in Austin. And after that, fortunately, I got into the IDP program at IU. This is our class. This is the class of 2026. We are 16 candidates in our class and we are tightly knit. So to talk a lot about the program, over here is our program director. She's Dr. Cho. It's a 20-month program. It starts from D2 spring semester. It is mostly consisting of 15 to 16 candidates depending on the openings in the class. It has D2 spring and a whole D3 and D4. One good thing about the program, we are treated as same as the traditional dental students. We have a little extra courses in D2 Spring, and after that, we collaborate with them and we have the same curriculum as them. To talk about the curriculum, it's D2, D3, and D4. Initially, in D2 Spring semester, we have our extra IDP courses where we work in SimLab for removable processes, fixed prosthodontics, complete denture, and we also have a bench test for all of them who thinks that the previous batches didn't have a bench test. After we got accepted, we do have a bench test for the course, and we do have exams and didactics. We also have few courses like ClinMed, which we take with the traditional students. And jumping into D3, we have summer, fall, and spring. During the summer course, we were just doing patients. We scheduled patients morning and afternoon, and we started doing comprehensive oral care. And in this fall semester, we start didactic courses, which includes implants, orthodontics course, and some pharma. And after D3, we come to D4 and we start doing patients from D3. So we try to complete our requirements for graduation starting from D3. And mostly in D4, we do have some courses, but we mainly focus on the requirements we need for graduation and preparing for boards and preparing for residencies if you are interested in that. And to talk about a typical day in my school, we have lectures from 8 to 9 every day during the fall and spring semesters. We did not have any lectures during summer course, but yeah, we do lectures from 8 to 9. On Thursdays, we have full day of lectures and classes. We also have sim labs on Thursdays for implant course. And we do clinics from 9 to 12 and 1 to 3:30. We can schedule one patient during our morning session. And we also have SimLab for aesthetic dentistry and orthodontics, and that's how a typical day at IU works. We have, apart from curriculum, we have many student clubs over there. For example, ADA, ASDA, Kids Club, Women in Dentistry, etc. I'm a fundraising chair for ADA, and I'm also a part of ISDA, that is International Student Dental Association. I'm part of Kids Club. These are some of the events that I've attended with the student clubs. IU is really high on student clubs. We have so many opportunities and they gave us IMRs. So to graduate with DDS degree, we need to have 40 intramural hours, which count towards our volunteering work or research, something like that. So these events count towards our IMRs. And final thing, and the main thing, talking about CAPIT, I know so many must be thinking what I have in my profile and what is my personal opinion and how to get an acceptance. For me personally, my profile consisted of dental assisting, dental shadowing, teaching assistant, and I also worked in research. So I got some research publication over there. I did some school tours with different schools, and I also have some volunteer work. I worked at Stony Brook dental school. I shadowed a dentist over there in their faculty practice. I was also associated with the research in Stony Brook in the Department of Periodontics, and I was a dental assistant in three different private clinics, different times. I was also doing COVID contact tracing and different other things because right after I moved to USA, COVID hit, so everything was virtual. And personally, if you ask me what is one important thing for CAPIT application, I would say having a holistic approach towards the application. And I believe it should consist of good SOP, LOR, and CAPIT application. People might say SOP and LOR might not be of much use and they're overseen, but after my experience here at the school, that is the only thing that school will know what you are as a person. So having a good statement of purpose and stating your story over there is really important. And talking about like recommendation letters here, with the schools in United States, they really look into your recommendation letters, and having a really strong recommendation letter would be good to show that you're a good candidate. And having a good approach towards CAPIT application is one thing I would say that's really important to get into the school, because the first thing you need, they look at, they want to know before they call for your interview is your CAPIT application. So I believe stating every work you do, like every experience you do in the CAPIT application is really important. So don't oversee anything, even the minute detail you might put would be an eye catcher or a deal breaker for the school. Then comes the bench test and interviews. Some schools have bench test first, some have first interviews and then bench test. But I believe doing good in bench test is really important. This cycle, IU started having bench test again. They stopped it due to pandemic, but they started doing bench test again. So they ask for a bridge prep and also a class 2 cavity prep. So they look at your hand skills. They look if you have a learning curve or not. They have a holistic approach towards it, but I would highly say it's not the deal breaker. They also look at your interview and your application. So you need to do well in your interview. Just know your red flags and things you should not say in your interview, and say see what school is looking for, and just talk about it. I believe, and I just wanted to put my acceptance email over here. I know it's a dream for so many people. I got so many rejections and this acceptance after so many emails. So this is a big thing for me. And I think that's it for now. So if you have any questions, please go ahead. And these are some pictures from my recent white coat ceremony. And the middle one is from Give Kids a Smile event that we went. Yeah, that's it.
Thank you, Dr. Bala. I mean, this presentation was really concise and quite accurate to what you mentioned. And congratulations on your white coat ceremony. I did see a couple
Thank
of
you.
pictures on your social media, so it was really nice to see and share that celebration with you too. So Dr. Bala, I did have one question. Could you talk about more about your experience where you mentioned about Stony Brook Dental School, and like for if we were to seek for a teaching opportunity as teaching assistant, how do we go about it?
So initially, my first teaching experience was during my master's. I was doing my public health, and I got an on-campus job as a teaching assistant for an undergraduate course. With that experience and with my experience back in BDS, I just started looking for contacts in every dental school. I just opened Google and searched for all the dental schools in the USA, and I started sending cold emails for every faculty over there. And luckily, one of the faculty from Stony Brook reached out to me saying that because of the pandemic, they were not able to find anyone who would just volunteer to do a teaching assistant position. I was volunteering for a periodontic residency program lecture. They used to have it twice a week, and I used to create quizzes, grade their courses, and assignments. And also, as I was having experience with public health, they wanted to give me a few lectures about research and how they can do statistics for their research. That's how I got the opportunity. So if you ask me one suggestion on how to get a teaching experience, I would say start with a cold email saying that you have some kind of teaching experience back in home country, and try to reach out to as many faculty as you can. And I hope someone would reply back. Yeah.
Okay. Thank you so much. Does anybody else have any questions? Another question was that I did see about Indiana University in particular, they also seek for an LOR with respect to community work experience. So,
Mhm.
can you tell us more about that? Like, are they looking for something very specific in terms of community service, or like, and how many hours do we have to go about it?
Okay, so particularly for IU is one school that gives high importance for community service. They want your application to be holistic with research, community teaching, like every aspect of dentistry. So for that, they're looking for a community service letter, and I believe it's not something particular they're looking for. Any letter from any organization would work, but I would say try to get something from United States. They are highly on that, and also the community service should be a minimum of 50 to 100 hours. That
Okay.
was for my cycle, and I heard that after that they reduced the minimal hours, and they just say that you need a letter to prove that you're associated with some kind of volunteer work. This shows how you are as a person, and this shows your commitment towards community. And they made it an requirement to complete your application.
Okay, and just to add to that, so it does not have to be related to dentistry or
No, 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 no. So for me, I got my volunteer letter from Red Cross. I was a blood donor ambassador over there. I was working as a volunteer while the blood donation drives were going on. So that's how I got it. So I had the same question. So I reached out to my school that time, and they were really helpful in answering my phone calls and replying to my emails. So
Okay.
it was really good experience for me. Yeah.
Okay. And could you tell us more about like your class in general, the number of your like the students in your class, and what do you think is Indiana like, since you've already met with your classmates and everything, what do you think? I know you still mentioned that Indiana is looking for a holistic approach, but could you just give us a bit more information on what was your perspective when you looked at your classmates and what they were looking for in general?
My class is mix of students with different backgrounds and different experiences. Indiana is one school that wants to have diversity both in your academic level and also in different aspects of dentistry. So there are few students who are graduated right after school and just got into the program. There are few who did their masters. There are few who practiced like 10 years back in home country and came here, like taught in home country and came here. They just look at they want to know if you can learn and see if you have a learning curve over there, and they want to have a class with mixed students so that one another can help each other. So luckily, fortunately, in my class everyone is really good, and we communicate really well between us, and we help each other. For example, if I'm really bad at fixed, one of my classmates is really good, and he teaches us the whole thing about fixed prosthodontics and complete denture, and we help each other with patient care, and we are good in person. So I believe school wants to know who you are as a person and see if you want to be a team player or not. And school really likes if you're a team player, and they also want to see if you have this kind of experience back in your application profile.
Okay. Um, we do have one question in the chat box. It says, "Thank you, Dr. Bala, for all the information you gave. You did mention regarding the SOP has to be strong aspect of the application. So, what are some things you think can make an SOP stand out?"
Initially, people are afraid to put their personal stories in SOPs. I have been trying to help few students with their SOPs. I was trying to just review everyone's SOP, and it's general. Everything is same. Everyone says that we've been to a dentist, we got inspired from there. My family member was back with the dentist, and that's how we got inspired. But school wants to know your personal story. They want to know who you are. Even if you don't mention anything about dentistry, but just write why you're here in USA, that would work for you. It really depends on your the touch you're giving for the statement of purpose. It just needs to say why you are so much interested towards dentistry or towards this profession or towards helping people, rather than just giving or mimicking your CV. I've seen students who are just writing their CV again in their personal statement saying that I've graduated, I've done this, so I'm interested. Rather than that, just take one aspect of your application and try to explain that more in your SOP. That would make your application stand out rather than just giving everything in your statement. At the end, I would say personal touch.
Yeah. Yeah, that's a great answer, and thank you for the great question, Ikra. We have another question from Shushmita. She's asking, could you please share any tips on how to prepare for interviews?
I initially, in my first cycle, I got interviewed from 3 schools. I was waitlisted over there, and then I started to look what was the mistake I was doing. I was afraid to show who I am. I was just trying to mimic that I'm really interested into the school. I'll do whatever you want. I'll just be there and I'll say I was just trying to say that I want to get into the school by hook or crook. But that's not how you want to be in your interview. Just be yourself. Just smile. Just crack jokes, and when they ask a question, just think about it and answer how as a person you want to answer it, rather than how as a capid applicant you want to answer. For example, if they ask about research and you don't have any experience about research, just don't try to mug up. Just say, yeah, I'm interested in doing research, but I haven't had any opportunity, or just say I'm more into clinicals and I don't want to do any research. Some schools like students who are more into research. Some say we need something more clinical, but we just don't know which school wants what, because every school says that we look at the application holistically. So just try to be yourself and don't try to mug up the answers. That's how you can ace an interview.
Okay. So was this like your second cycle that you got through, or like how many cycles did
Yes. So this was my second cycle. In my first cycle, I got interviewed from 3 schools. My second cycle, I got interviewed from 7 schools. I got 3 acceptances, and I chose I.
what did you improve when you were applying for your second cycle? And like, what did you work on? And did you
Good
also
question.
go to change your SOP or your LORs?
Good question, and the answer is nothing. I changed nothing. It was same SOP. They were the same LORs. The only thing I believe I changed is the way I put my capit application. Initially, I was doing the bullet points with minute details over there, but the next time I tried to put everything I did in like giving nitpicking details of every experience of mine. For example, when I put about my blood donor ambassador as at Red Cross, initially I just told about my responsibilities. In my second application, even with the given limited space over there, I tried to include one of my experience on how I tried to help a person who was feeling dizzy right after donating his blood. I believe that's one thing that changed the that strengthened my application. And apart from that, I wouldn't say anything. And my TOEFL scores were consistent. First time I got 105, second time I got it was expiring, so I had to take it another time. It was 106.
Okay.
My statement of purpose was same, because I just poured my heart out and I just didn't want to change it anyhow. And my recommendation letters were from the same dentist and the same faculty from school. So even I'm not sure what worked out over there, but luckily it worked out. Yeah.
Okay. Since you mentioned about the CAPIT application, and how about going with bullet point, how you describe your volunteering experiences. So do you advise that instead of just going by bullet points and sharing responsibilities, we can share our story there too? Like, can we explain our experiences in that way?
I would say put it a mix of things over there. So even if you, their main point was to know about the know about what's happening with your experience over there. So try to give an example which explains both your personal aspects and also explains what were your responsibilities over
Okay.
there. I would say just keep it a mix of both of things.
Okay. Thank you. Nardine, you have a question?
Yeah.
Yeah, hi. Thank you for your helpful information. Appreciate it. So my question is, do you think we should include our bench test preparation course in our CV? And for your background, so for how long did you train on doing for the bench test?
I would say highly yes. Always include if you take any bench test courses, because that's how you would say that I'm committed towards this and I'm tailoring myself to be better at the program. So faculty love if you already have some kind of experience with the bench test, because they don't want you to teach from the beginning, from the basic, because we start from D2. It's and they try to include us with the traditional students. So they want to see that you know basics and they can shape you in a better way so that you can practice well here in the US. So I would say always include your bench test experiences and your courses with it. I think we have one more question from Noruddin.
Yes. Her question is, do you think school sets up students well clinically after graduation?
Yes, so there are quite a few reasons why I chose IU when compared to other schools. IU is once only dental school in the whole state of Indiana. So we have a really large patient pool, diverse patient pool. It's not like we have patients ranging with all age ranges and all kinds of insurance. So we have different patient perspectives, and we have high requirements both in prosthodontics, implant courses, and they even encourage us to do molar endos while we were in our D3 and D4. And we also have a requirement to finish a molar endo in our D4. And I believe this will prepare you really well for your future endeavors, like in your private practice. And we also have rotations with private practice in our D4 for 2 weeks, and they also set up us with a student outreach clinic or a hospital based dental clinic where we need to go and complete a rotation over there. So this shows us how well we are prepared for private practice or how well we are prepared for real life dentistry, and this helps us a lot. And also IU has a system where they assign as a clinic director. We are divided into different groups, and each group has a clinic director, and he assigns us patients and we take care of the patient. So whatever doubt we have, the clinic directors are really well acquainted with all the patients, and they try to help us in any way possible. Let it be a clinical doubt you have, or patient is not showing up, or you want to do more with your patient, they'll help you really good.
I'm hoping that your question has been answered, Nuruddin. Anybody else who has any questions can feel free to put it on the chat box or unmute your mics. So I had another question. Do we have to do a master's program or a preceptorship program when we come to the US?
No, for a master's, not sure about preceptorship, because preceptorship gives you the same experience you're doing it uh, in a private practice. But one important thing that we need to note about preceptorship is like we'll get to know how the school works. We'll get in touch with the faculty over there, and they can see personally who we are and try to help us. When I'm stressing out to go on a school tour or just stay in contact with the faculties, because they need to know that you're interested in the program rather than just looking at your application. Because even with your application, SOP and LOR are the only things that will show your interest and that will show who you are as a person. If you stay in good touch with them, they'll know how interested you are and they'll try to help you more. And talking about preceptorship, that's my opinion about that. Yeah. And about masters, it would give you experience with US education system that would help you to excel in your DDS program, but I wouldn't say it's necessary. My class consists of students who did not do any masters and who did masters, and I also have been teaching here in the US. So it's a mix of students, and I don't think that's one of the factor that makes you stand out.
Okay. And does your class also like have fresh graduates, or have you seen over the course of like your seniors or something?
Oh, yes, yes. So our class has 16 students. I believe three students are fresh graduates, three did their masters, four were working back in home country for like 4 or 5 years, and rest were working here in the US as dental assistants or faculty or in research for like 10 years. And we have someone who have background from pharmaceuticals, we have background from dental assisting. It's a diverse class, it's a varied experience. So I would say we have so many different things out there.
Okay. Yeah, I mean, that's a very detailed explanation about your class and the statistics that we received too. Thank you so much. Another question I had was, you mentioned about the IMR. So could you tell us more about that and how it's associated with your academics too?
The IM hours.
Yeah.
So IM hours means intramural hours. We need to have 40 minimum intramural hours to graduate, and these hours consist of either research, volunteer work, or anything pertaining to dentistry apart from academics.
Okay.
So we need, they just want us to experience different aspects of dentistry. So they want us to just go wild with it and just try to experience different things so that we'll know what we are, and we'll try to find what our interest is. We also have GLA trip, that's global learning, GLS, global learning service trips, where we can go to, they send us to Guatemala, Brazil, Mexico, different other places, and we go there, treat for a week or so, and come back. That shows, that gives us an experience of a world, a global perspective towards dentistry. So even that pertains towards our IMR. So they make sure we are volunteering or doing something apart from just academics. They want to make us a person as a whole. So that's good, I believe. Yeah.
Okay. Thank you so much.
And I forgot to mention, some students might be having questions about if we have any on-campus job opportunities to do while doing DDS. And IU is best school for that, I believe. As of now, I am working in orthodontic department forecasts for um, residents who take impressions. So IU has different opportunities over there where we can work in libraries, we can work in labs after hours to get some on-campus job too.
Okay. We do have another question. What made you choose Indiana from all the acceptances you got?
This might be silly, but I'm married. I need to look after my living expenses. So I got other acceptances from East, like I would say California. So it's like pretty costly for me. And apart from that, the patient pool Indiana has, this is like really good. And I get varied experiences over here. I've been seeing that since past few years. I've also spoke with different students from the program, from all the different programs, and I got really good opportunities. I've heard really good reviews about this IUSD, and also IU has really good residency program. They like students who are loyalists for IU, and they have a good chance getting into residency here at the IU school itself. So I'm mostly looking towards pediatrics, and Riley School of Riley Children's Hospital is associated with IU, and that is one program which is both university and hospital based, and that's one of the best programs here in the US. So that is one of the factors that made me choose IU. I would say cost of living, different other things, but these are the main things.
Okay. Um, so I think we've answered most of the questions. We've already taken a lot of positive intake from you, but what would you advise for aspiring dentists here who have have gotten rejected or who've been not gotten through the first cycle, and in general as well, if you have anything more to share with us?
Again, this would be generic for everyone, but just keep trying. It just takes some time. I know this is more competitive than the traditional DDS program. There are so many applicants. We don't know what schools are looking for in specific. I try to get as much information as possible from different schools on what they're looking. I was unsuccessful on that, but I would say keep trying, keep improving your profile. And I've been seeing tremendous improvements in TOEFL scores nowadays. My class has an average TOEFL score of 109. The highest was 117, and the lowest was 105. So I believe that is one thing that might make your application stand out. And keep doing volunteering work, just that will show how good you are a person and how you're committed towards community work. Any experience you get apart from dentistry in medical field or healthcare anywhere, just grab the opportunity. Here in US, I am on my F1 visa. So students with visa, it's really difficult to get any kind of job outside apart from your university. So if you're doing any education or masters, try to look for opportunities in your campus so that we can work and get some money over there. If not, try to look for volunteering opportunities. There are so many dentists who are able to give you volunteering dental shadowing opportunities and assisting opportunities. So try to grab them, and that would be really good for your profile. Just keep trying.
And with that said, we'll definitely take the advices. And thank you so much for being a part of this session and giving us your valuable time. I really appreciate it, Dr. Bala. Lastly, if any of y'all want to reach out to Dr. Bala, what's the best way to reach out to you?
I'm a little active on social media. You can reach out to me on Instagram. If not, I will ping my email ID over here. You can email me.
Well, thank you so much and have a great evening. Thank you so much, everybody.
Thank you
Bye-bye.
so much. Bye bye.